Good morning, and welcome to the inaugural CMS conference on optimizing healthcare delivery to improve patient lives. I'm Stace Mandel, Acting Director for the Office of Burden Reduction and Health Informatics at the Centers for Medicare and Medicaid Services. Thank you so much for being here with us for what is going to be an informative and very exciting day. We're so happy that you took the time to be here. To get started, I'm hoping that you can go into the chat and let everyone know where you're calling in from and what topics brought you to today's conference. As of our last check this morning, we have over 2,400 folks registered. We think that speaks to the strong desire people have to talk about challenges that may be posed by administrative burden and what can be done about it. Shortly, you'll hear from the CMS Principal Deputy Administrator, John Blum. But first, let me provide the background on why we're here today. The Office of Burden Reduction and Health Informatics, or OBRI, was created with a focused mission to reduce administrative burden and advance interoperability in national standards. We actively work to accomplish this mission by integrating technology, policy, and regulation, and regularly engaging stakeholders to improve healthcare quality, patient care, and population health. Since the office's inception, we've heard from you through a variety of channels. We've worked with our colleagues across the agency to launch robust efforts to understand administrative burden and the impacts it has on clinicians and patients, and to identify opportunities where we can affect change. Based on your input, CMS has made changes that will improve prior authorization and advance interoperability. We've also promoted the adoption of FHIR-based standards for application programming interfaces and provided clarifying guidance on national provider enumeration, as well as many more changes, which John Blum will highlight shortly. When these changes are reviewed holistically, they result in time and money saved and burden and barriers removed. Today, I'm excited to continue to build relationships with you and facilitate a dialogue on these really important topics. We all bring unique and valuable perspectives to the table, and together we create solutions to the challenges. Please allow me to tell you a little bit about myself. So, I'm a social worker and a nurse by background. And as a nurse, I spent much of my career as a frontline nurse and in nursing administration. I proudly began my career as a nurse in the United States Army Nurse Corps. Those decades of work were really hard. And I was there when we transitioned from paper charting to using an AHR. I remember training in the early 90s on Hewlett Packard machines with the pen that pointed at the screen and the large spools of paper that generated medication lists and treatment plans. I remember in 2001 that while caring for patients, we had to use three different systems to enter data in, one for medications, another one for dietary services, and yet a third for labs and radiology. And we still document it in paper based charts. We've come a long way since then, but as we know, continuous improvement, including addressing inefficiencies, is how we work to optimize healthcare delivery. During the next few hours, you're going to hear from leaders in the field of burden reduction, sharing concrete steps to address some of the most pressing issues related to reducing administrative burden for patients and healthcare workers. We sincerely hope that you can make new partnerships today and meet other colleagues who share the hope for a healthcare system that operates seamlessly and equitably. In our time today, we also hope to learn more from you firsthand about what your challenges are, what's top of mind when it comes to delivering healthcare, and what optimizes that and what challenges that. We want to learn and understand your burdens, knowing that not all burden is bad. Some of what we considered so burdensome back in the day were steps that were needed to save lives. Imagine now if we didn't carry out the preoperative steps that safeguard surgical patients, or take the necessary steps to safeguard patients from infections when we insert Foley catheters or place central lines. Those aren't really burdens, those are obligations. There's truly a difference. So I'm super excited for today. Thank you again for joining us. Now I'm very pleased to introduce John Blum, the Principal Deputy Administrator and Chief Operating Officer for CMS. John oversees CMS's program policy planning and implementation and the operations of the entire agency. He previously served as the Deputy Administrator and Director of the Center for Medicare from 2009 through 2014, leading the agency's Medicare payment and delivery reform strategies and the policy and program management of the Medicare program. John has more than 25 years of public and private sector experience in healthcare policy and administration. In addition to his positions at CMS, he has worked as a strategy and management consultant and executive vice president for medical affairs at Care First Blue Cross and Blue Shield, professional staff member at the Senate Finance Committee, and a program analyst at the Office of Management and Budget. Prior to joining CMS, John served on several nonprofit boards with missions to improve access to equity to healthcare and health coverage, including Mary Center, a federally qualified health center, the Primary Care Coalition of Montgomery County, and the Medicare Rights Center. Please join me in welcoming John Blum.